This is yet another case of third ventricular surprasellar craniopharyngioma removed through an endonasal endoscopic approach. Vascularized nasoseptal flap is harvested. A transtuberculum approach is performed. In this case, the carotid arteries are fairly close to each other. The bone opening extends down to the top of the sella and up to just below the optic chiasm. The superior intercavernous sinus is identified, both above and below, and then is cauterized and cut. And the dura is opened between the carotid arteries, extending all the way up to just above the chiasm, since the resection will be done between the gland and the chiasm. The superior cavernous sinus is cauterized there, and then the dura is completely removed with a kerrison. The tumor is immediately identified. Once the arachnoid is opened, it is sharply dissected free from the bottom of the chiasm, and then dissection is performed laterally around the tumor to make sure there are no arachnoid adhesions to the solid component of the tumor. The stalk can be identified, which is preserved as long as possible. Below the tumor, the basilar tip is identified. The tumor is internally decompressed. First, the stalk is preserved as long as possible. The suprahypophyseal arteries have been swept laterally to preserve vascular supply to the chiasm. Solid components of the tumor are removed and sent for frozen and permanent section, consistent with craniopharyngioma. Once enough of the tumor has been internally decompressed and dissected free laterally from the PCA and third nerve to ensure no attachments, the tumor can be mobilized away from its superior attachment to the floor of the third ventricle. Once the tumor is completely removed, a gasket seal closure is performed with fascia lata held in place by MedPore and covered with a vascularized nasoseptal flap and DuraSeal. Post-op MRI reveals a gross total resection of the tumor.